What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering why being too quiet at clinicals can hurt you. So to give you context, I am a night shift Xray tech, been doing it for over 4 years. Here to give you your daily dose of radiation. As always, I'm here to educate you in this beautiful field of radiology, because when I was a student, no one would cover it in this way. So, I personally, to give you an example, I am antisocial, very quiet, I don't really talk, even at work, just there to push the button, go home type of person. So, as a student, I remember going and being quiet, observing. If anything needed to be done, I'll get the job done, but I was very quiet. I mean, with the patients, I would talk, do what you were supposed to. But with most of the techs, I would just sit there quietly, waiting for work, wouldn't socialize too much. And that was fine until it was time to give evaluations. And I remember it was my first clinical site, which is where I work at today. And it got to the point where my teacher and even the manager, which is the CI of the hospital, would pull me over and ask me if there was a problem. And I was like, what do you mean? And they're like, all the techs say you're quiet and you don't talk. And I'm like, is it like, I was confused, because I was like, to my knowledge, I was doing everything right. And they're like, well, it's not that you messed up or anything. It's just like some of the techs feel that you're like, you just don't want to talk to them. You have a problem, or you feel entitled, or that we're just trying to get to know you better. And I was like, no, just quiet. I'm like, how's my workflow? Is it like, from a student perspective, it's like, everything's been perfect. We're just trying to figure out what's going on with you. And I'm like, there's nothing that's going on. Like, this is who I am. I'm just quiet. And they're like, okay, cool. We would just make sure we clarify that, because I didn't want that to affect your experiences or how you interact with patients. I'm like, me being quiet with the text has nothing to do with how I treat the patients. Like, I'm there, I treat everyone the same. I'll be more talkative with the patient, try to, give the patient care experience. But with the text, even now at work, I'm very quiet. I don't talk too much. Which that apparently had a hindrance. And even one time, the first time it happened, even the teacher, when I went back to schools, the clinical one, kind of brought me in and they started asking me questions and stuff, if I had problems with anyone. And I was just thrown off, because to my knowledge, I was doing everything good. So if you are more quiet, maybe socialize a little bit, get something going, to help you prevent that problem from happening to you. I do know that if you're on the opposite side and you talk a lot, what happens is you about to piss off some of these techs, because I seen it as a student with one of our classmates, and even now as a tech, especially me who's a night shift, I'll be dead, right? And we'll have one student and just talk on and on and on and on and on, and you're just there like, bro, it's 6 a.m, dog. I'm trying to go home. I mean, I'll never judge anyone. I'm like, you're full of hopes and dreams, and this is who you are, and you talk and whatever. I'm like, I'll never hindrance to that, as long as it doesn't get in the way of us doing the job. Because like, you can talk and talk and talk, and I'll be like, all right, I'm gonna have to cut you off. We gotta go push the button. We gotta do this, and it'll be fine. Other techs that aren't as nice or don't like students, you about to piss them off. I'm just letting you know that. And it could affect how they treat you in as far as checkoffs, and it can affect you in other aspects. I'm telling you, depending on who the techs are and how they, like most techs at my place, I would say 25 are chill, like me, and the other ones are more uptight, and some of them don't like students or give them a hard time. So it really depends. You have to kind of find the neutral level, because as you're a student, you're there in debating of, do you want it, how professional you keep it, to where there was techs out there at work, which I still work with today, that were like so chill to the point where your professionalism kind of dropped. But then at the same time, I would have to remind myself, I'm still a student. I have to be careful. So I'm hopeful for anyone out there who's going through clinicals that you find good techs that educate you and treat you well and that are chill, because I would hate for you to go to a site and then they don't like you, they hate you, you have bad reports, because in clinicals you have a higher level of threshold as far as the grading. Like, it's more narrow as far as like the grading scale. Well, at least with my school it was. So you have to be careful in that part too. So that's just some info for anyone out there, depending on where you fall on the spectrum of if you talk a lot or you don't talk a lot. You want to be in the middle. But as always, you always want to be out there being active, getting stuff done, trying to help, and trying. And then there's sometimes you try to help and you'll be in the way, so you have to kind of know the fine line of where you want to be, because sometimes traumas come in and I know the student wants to help, and I look at them and I'm like, yo, bro, it's a coach STEMI, it's a da-da-da, whatever. I was like, you could try, but we just, if we push you out the way or we seem kind of pushy, like, I'm sorry. Because sometimes it's literally life or death, and you better get it. Sometimes it's literally you have one shot to get it done. If you're in a code, and I would hate for any bad experience for a student, because I know some students, if you say anything, if you are pushy, if you they take it offense to it, to their personal. Like, to them personally, based off of their personality. Because some people, you can say something and it will piss them off, or they'll go to upper management, or they'll go to their CI and they're like, hey, this tech don't like me, he said this, he said that. It's because of me. It's because I'm too quiet, or it's because I'm too talkative, or wherever you fall in the spectrum. I'm just letting you know that to help you out. So hopefully you find this video informative and you enjoy this beautiful world of radiology, because I hope one day, if you're watching this, you can get to the point where I am, where you literally have a good job, make good money. If you want to work overtime, you can make a little extra money, and you're fortunate enough to have decent, not too shitty equipment, and you can live a decent life. So if you want funny memes, check out the link below. I have some memes there, or you can check out my channel where I post daily on this beautiful world of radiology. As always, see you on the next one.